Hi everyone, I'm Dr. Ipshita and welcome to my channel. This is the very first video on my YouTube channel, so I may make a few errors or a few glitches here and there. So please bear with me. Now, this video especially if you're a dental or a medical student, an undergraduate who's planning to pursue a career in public health. Now, I came up with this idea because a lot of my students have been approaching me since years now, 2, 3 years, and they've been asking me if a master's in public health dentistry or a master's in public health, which amongst these two would be a nice fit for them. So over the course of time, I realized that although I had a certain amount of idea about both of these fields because I'm a public health dentist myself, but then I thought let's just call upon a professional who's got all of the knowledge about a master's in public health in depth, so which is why we've made this video. And what you'll see ahead is basically a Zoom meeting or an entire in-depth interview that I had with Dr. Himangi Bhardwaj, who's a very reputed doctor, and she's working in the British High Commission at New Delhi, and she's done her MPH from TIS, that's in Mumbai, right? So if you have any questions at all pertaining to a career in MPH, what is it? How long does it take? Is it recognized in India? Is an MPH from India recognized abroad? How much does it cost? Where should you do it from? Are there any particular fields in an MPH? Who's it best for? What kind of subjects are taught over there? What kind of tuition fees are you going to pay? Is there a waiver in the tuition? What kind of jobs is it that you're going to look at once you're done with your MPH? So if you have any of those questions, this is the video for you. You must go ahead and check it out. It's slightly long, but trust me, you will get all of your questions answered. And if you still feel like there are a few questions which weren't answered, please put them down in the comment section and I will make sure that I find the answer to it and I will give you the answers in detail, right? And otherwise, if you still have any more doubts, you can reach out to me on my mailing ID, which I will link below in the description box. So yeah, please do go ahead and enjoy the video. I had a great time filming this with Himangi ma'am. She's uh, a wonderful senior. And ma'am, if you're watching this, thank you so much for being a part of this particular interview that went on Zoom. Trust me, you're going to be helping a lot many students all across the country. So thank you so much and enjoy the video. So for everyone who's joined us right now and who's in this session with us, thank you so much for joining us. So basically this session is everything that you need to know about a career in public health, whether and mostly so in masters in public health. And we have with us Dr. Himangi Bhardwaj. Thank you so much, ma'am, for joining us. Ma'am is basically a senior health advisor for the UK in India, and she's based out of the British High Commission. So that's something, so many things that ma'am is doing, and so many amazing things. Thank you so much for joining us, ma'am, for taking out this time. And so, amongst the few things that ma'am officially does, one is government to government engagement of health and life sciences. You also look into health systems and policy making. And ma'am has contributed a lot to the COVID-19 research preparedness and response, and which was also recognized by HMTQ 2021. I hope I've introduced you correctly, ma'am.
Yes, you have. Don't worry. Thank you so much. That's very kind.
All right. So, ma'am, before we get on with the session, so I just want to divide the session in two parts. So, the first part would be we'll just talk about you so that people understand who exactly can get into and who exactly can do a master's in MPH, and and then in the second part we'll cover what MPH is all about, what do you study, what kind of work there is in it. So now, ma'am, if I had to leave it to you, how else would you describe yourself?
Thank you so much, Ipshita. And that's very, very kind. So, first of all, thanks to you and thank you to others who are on the line. I mean, it's difficult to take out time on a 6 o'clock on a work day, and people have taken that time out. So, a big thanks from my side. I won't say I've done a lot of amazing things, but I do think that this is an interesting career to be in. And I think COVID has definitely shown the importance of public health to us. So, in terms of introduction and what I do, I would actually say that I have been very curious from the time I was in college. So, it's easy. Actually, I think it's sometimes easier to follow the path of what you've started and think, okay, now that I'm in this career, let me do only this. That's sometimes easier than trying to break out of it. And I think what where I have got to, or how I would introduce myself, is somebody who has tried to follow my passion. So I've been very passionate about public health. Even when I was in college, I always used to think, what we do impacts one person's health, which is
Right,
very
right,
important, obviously. And like a majority of the medical fraternity does that. But what is the impact, or how can we impact like a bigger population?
right,
Can we do something as clinicians who understand the system? Because a lot of our health system is run by administrators.
right.
And I won't say that, they make like bad public health professionals, but sometimes you do need like the public health background and the medical background to understand what goes into that system, to have that
Right.
empathy. And I believe many of us have that already. So, just to introduce my role, I think it's exactly as you say. I lead all of the government to government engagement on health and life sciences in India. So, whatever the UK does in cooperation with India from the government side, not the commercial side, which I'll come to separately, but whenever the two governments are talking together about health, then that comes through the team that I lead. And the latest example is, Prime Minister Boris Johnson, when he visited recently, he launched like the UK India Digital Health Partnership. He also launched officially the recovery trial in India. So all of that work, my team and I have led so that it could be announced. So it's quite a varied profile. And I think as we go through the questions, we can unpack a little bit more what my team actually does on a day-to-day basis.
Exactly, exactly, ma'am. As we cover these questions part by part, I think it will get people will become more acquainted with what is it that you do and what other things are there for them. So let's just start from the beginning. Now, I haven't told the audiences yet, but ma'am is an alumni of ACDS, Army College of Dental Sciences, and ma'am has a huge name there. So we've known you, ma'am, before you had passed out. I mean, after you had passed out and after we had joined. So did you always want to become a doctor? Let's just start with that. But I'm guessing from my answer, you did.
No, so I think when I was much younger, maybe not. But I think once I came into sort of like, when you're in that 10th phase and you're choosing your subjects, at that point, it was quite clear to me that I want to be in the health space. Whether I wanted to treat patients or not was not sure. I remember distinctly this phase when, without really knowing what a neurosurgeon does, I just wanted to be a neurosurgeon just because, you thought, oh, it's so
So cool.
glamorous.
Yeah, right,
And
right.
then, yeah, exactly. Like, that sounds like such a fascinating thing. And at that age, you always want to impress the people around you. So it was all about, it'll be so nice if I tell somebody I'm a neurosurgeon. But I was always quite drawn towards, getting to know people more. And not many people know this. In college, some people knew it. But before I got into medicine, I had a seat in journalism
Oh,
that I got at Lady Freedom College, yeah, in DU. So I knew that I wanted to do something where I get to interact with people a lot. And if I was not going to get medicine, then I thought, okay, then I should do journalism, something else where I can talk to people a lot. And I love talking, as you will realize. So
so that's
talking to people
fantastic.
and
No, so ma'am, I feel like this is very important. It's important for people to understand your story, especially so because I see a lot of my students who are so confused now. We don't know if we want to do dentistry. We've come here maybe not because we wanted to, and at some point I feel everybody joins, but it's mostly because of so many other reasons. But they shouldn't feel like they're the only ones who are stuck like this. Everybody goes through that phase, and you can still do so many things after you've done your PTS. I have seen so many students who are still confused and feeling bad about what do we do once we get out now. Is an MDS very required, or are we only going to be doing clinics? So which is also the reason why we're doing this video. All right, so ma'am, moving away from college now, how did you decide that you wanted to pursue a career in MPH? Because back when you took it up, it was a very unconventional career to follow through, right? Most people were either doing MDS or joining a clinic or maybe going to the States. That is one another thing that people were very crazy about. So how come, why MPH at that time? And how did you come about it?
so this is a very interesting question because it links to what you just said. At the time when I went to ACDS, almost 80%, I would say 90% of the people who were there because they did not get a seat in MBBS. So
Yeah.
it was almost like you applied for MBBS, you didn't get it. I mean, even our system is geared like that. You know, the
Yeah,
top
exactly.
percentile will get MBBS and then people get BDS, which I think is a totally flawed approach because it's another specialization. You should have people who want to be dentists,
Exactly.
not that, oh, just because you got 10 marks less, you should be a dentist. And I think because our system is geared like that, you basically go to a college pursuing BDS thinking, okay, I'm second best and that's why I'm here.
Right.
And so, you know, and it flows similarly. You'll get some people in homeopathy, some in Ayurveda. Majority of these people will not actually want to do what they are doing.
True.
So I think it's really important once we are, say, in BDS, we're already here to question, because many of the people I was with really liked dentistry or started liking it. Like they came thinking, you know, this is second best. But some of them turned out to be really good at the
Yeah.
work and thought, okay, like this is not so bad. I like dealing with patients. This is good. Some like me thought, how can I still do something else, right? Which where I can use this, but I want to expand. So what happened with me was that I finished my BDS and I came back to Delhi. My situation was such that at that time my parents were living in Delhi, and so I came back and I started looking for clinical work here, because the normal thing to do was that, like, you've got a
Join
BDS,
clinics.
you would try to join a clinic and then
Right.
get some experience while preparing for MDS. That's the career path. So I came here and I joined a clinic, and somehow I couldn't get a clinic very close to my house. It was quite far. And when I started working there, this clinic was very prestigious. I won't name names, but it was a very famous clinic in Delhi. And when I saw their approach to patients, like, the approach was, oh, this patient is coming, let's charge him for this, but also charge him for this. Let's not do this in this sitting, because if we can, if we do like root canal straight away,
Right.
then we can actually charge this patient for two fillings first. Then we'll do root canal. Then we will do the crown. And I started thinking, like, I mean, you go through the whole process of training for so many years because you want to do good for somebody. And then at the end of it, you sit in a clinic where you're trying to say, can I make the most money out of this patient? And even if the patient doesn't really require that procedure, that really put me off the private sector. That's not to say that there's not people doing really good work. I mean, obviously, all of us get dental work done, and it's a critical part of the health system. However, I thought, somebody at the regulatory space, at the oversight space needs to look a little bit more into what's happening here, into why somebody is giving the treatment that they are giving. And I think that system is somehow missing. So I started thinking while I was working here, in this clinic, and I did that work for almost a year. I started thinking, is there some way for me to do a little more? And I started researching quite a lot on, where else I can sort of go from here. So this is, I think, in 2008. Then in 2008, I got an opportunity to work. Essentially, this happened through a newspaper ad. So I saw an ad which said, SRL Diagnostics, which is a big pathology chain, is looking for people who want to structure their preventive health programs. And I thought, this is great. They also had a provision whereby if you wanted to practice, you could. So I managed to do some practice in the dental clinics that they ran. They were just starting with their wellness clinic concept. And I got a chance to look at pathology up close. How do you marry sort of like the testing that you do with other preventive health checks, etc. So it was a whole new world for me. Of course, we had done pathology, very academically in college,
Yeah.
but I hadn't really done it as a profession. And it was when I was doing this in 2009, I think towards the end of 2009, I started thinking, there's got to be more in public health than this. That's the time when I started researching MPH, and I came across the fact that Tata Institute of Social Sciences is launching a brand new MPH course. So I was from the first batch. So this is another joke about me. I've always been in the first batch of
First
every
batch.
college that I've been.
And newspapers have a huge role to play in your career, right?
Exactly. I mean, I came to the ACDS ad through the newspaper. I saw the SRL ad through the newspaper, and I read about this course. And at that time, one of the people I was working with in Delhi said, MPH is great and this is such a good institute, but it's a new course. Nobody really knows what it will look like. Government of India is very keen on this course. Some really good faculty is joining, so people should explore. They were, of course, talking about other people. But I started thinking, okay, why can't I do this? I had the mandatory experience. They had said between at least between 3 to 4 years experience should be there. So I had the experience, but I had never actually worked in public health before. So that's how I sort of, thought I'll give this exam. I won't really clear it, I'm sure. So let me give the exam and see what happens. When I cleared the written exam, I said, I'm not really going to clear the interview. Let me just go for the interview. When I cleared the interview, I thought, okay, now I really need to take a decision on whether I'll quit my job, because this does not allow you to do this course long distance.
Right. You have
So
to
you
stay
really
in
need to
campus.
be there for 2 years. So I was like, am I going to give up a career that's paying me, and go to a university and just start doing this? Because obviously that meant sort of quitting in a way and then doing this. But I think it was one of the best decisions of my life. And that's how I got into sort of like the MPH journey. But yeah, that's how I came to the decision.
Fantastic. And I am assuming you were married by then, were you?
I was.
So that's inspiration right there for all the girls, So even if you're married, doesn't mean that you have to stop studying. You can still explore so much. Go ahead, follow your dream, go about your passion. And like ma'am said, good things happen to those who wait, and eventually you will figure out what you want to do. You don't have to just do it right after BDS. You can take your time, take a year, take 2 years, and then because there's so much of pressure on students nowadays, ma'am. People just want to finish BDS and then get into something ASAP. You should, and I'm always telling people you can take 6 months or a year, maybe two, see what things are around you, see if you are enjoying working in a clinic, or maybe if you do, you never know, you might just not enjoy that. Or maybe you fall for that way too much and you want to start a practice right over. So we've talked about this, and how was your experience at TIS like? Because you have to stay there for 2 years, I'm assuming.
Yes, so it's a 2 years course, and I have to say that this really opened my eyes in a way, because I mean I do come from, like I think many of your students come from a really privileged background, in that my father was in the army, so I've led a very protected life. I've lived across the country, always had everything handed to me on a platter, and and at that point I used to think the biggest challenge is getting a seat in general category. I mean I went, and basically the world was opened out to me in a
Yeah.
way, which is why I think training in a multidisciplinary institute is really good, because at TIS, they first of all start with foundation courses, which I thought, you go there, most of the doctors in TIS will say, oh my God, why do I have to study civics again? Because I'm studying the political economy of India, I'm understanding the economy of India, I'm understanding how India elects its prime minister and president. Why do I need to know all this? But that is where you realize that health is not just the care a person gets when they come to a hospital. A person's health depends on everything around them. If they don't get good water, they will fall sick. If the air is polluted, they will fall sick. If they come from a really disadvantaged background, they will not be able to access health the way we do. And I think which is why going to a multidisciplinary institute, whether it's JNU, whether it's TIS, is fantastic, because especially for medical students, I think social sciences students get exposed to this much earlier, because you're studying all of this at college level, whereas our studies are very sort of focused. They're very detailed,
Confined. Yeah.
but they're very focused. Exactly. So in a way, you come from a very small world,
Yeah.
and your outlook gets narrowed rather than expanded when you're in a medical college or a dental college. Whereas when you go to a multidisciplinary institute, you start getting asked to question. And I think, medical education is the exact opposite.
Yeah, exactly.
Basically taught never to question.
Yeah.
So if you are told that, the mandibular nerve supplies this place, or the mandibular artery supplies, you cannot really question and say why.
Yeah.
Or, how is it proved that this is the mandibular artery? Of course, there's a lot of proof, but I mean, that's besides the question. But a political science institute, a social science institute will say, why do you think primary care is important?
Yeah.
Why do you think government of India should provide these services and not these services? How do you fix the price of a certain procedure in the government system?
Exactly.
And you start thinking that this questioning attitude is actually really, really important. And that's so I think what this or any multidisciplinary institute does, and actually a postgraduate degree that is slightly outside your comfort zone does, is get you to question, get you to expand your horizons, which is really fantastic.
And that's such a good point you're making, especially these 2 points. The first one around why we don't question anything. And that's another thing that I'm telling most of my students all the time, people have no questions. Even when you tell them, and I won't say that it's their fault. Even when I was a student myself, I would be so hesitant towards asking any question, thinking, oh my God, maybe you're not supposed to. And secondly, another great point that you made out there, ma'am, that, you have got to know a certain kind of history, civics, geography of the place that you're staying. You have to know what is important for what reason, right? You can't just say that because you're a doctor, you don't need to know the political system of your country. You do. Because at some point, even if you want to work in the government sector as a doctor, right, at the CHC or the PHC, you have to understand the organization. So these are two very
Exactly.
relevant points that you made. All right, so let's take a step ahead from in your journey, ma'am. So you finished your master's at TIS, and what next? Then you applied for this very prestigious, very big, nice, amazing job. I think it's the dream job that anybody would want. You're staying in India, but you're working for the United Kingdom. And for those people who do not know, ma'am has also been at the World Health Assembly. That was such a high point for I think everybody at ECDS. Just seeing your picture with that logo in the background, you in Switzerland, it was fantastic. So tell us about a bit of that. How did you find your job? How did you get there? And then, of course, how did you go to the World Health Assembly? What took you to Switzerland?
Thank you so much. And again, very, very kind words. So thanks a lot. So when you finish at this, at the right at the end, particularly in the MPH program that I did, which is health policy, finance and economics, you are supposed to do a field practicum for 6 months. So for 6 months, you actually go out in the field, you write out a thesis, but you also have to do a field practicum study. So my thesis and my study was based in rural Maharashtra. I went and stayed in a village in the Chandrapur district, which is called Garchandur. And I was doing that actually. That project hadn't really finished when I got my degree. So I took some time off to write a couple of papers because I had a lot of data and evidence that I had not actually written down. So I said, let me at least finish these papers and submit them, etc., and get these manuscripts ready. And meanwhile, I'll start looking for a job. By this time, I'd also come back. So I had relocated to Delhi. So this is another thing, another point I wanted to make. That for some people, you have to relocate sometime. And so don't think of that as like a roadblock.
Yeah.
Also think of that sometimes as an opportunity. Because you go to a new place, there is a possibility you'll get a new opportunity. And again, I essentially got this job because of my persistence on two websites that I'll suggest to everybody. One is called DevNet. So that's DEVNET. DevNet is essentially it's development net. It's like an employment website. It gives basically advertisements on positions that are available, but almost the entire development sector in India advertises on it. So any big job coming out in an embassy, in an NGO, even Government of India uses DevNet sometimes when they want consultants. Niti Aayog uses it. So it's a very, very good website. So that's DevNet. The other one I will recommend is NGO Box, NGOBOX. NGO Box also has advertisements from all the top NGOs that work in India. And these locations, not all the jobs are in Delhi or Bombay or Pune. They have jobs from across the country. In fact, many jobs are in the smaller cities because a lot of the public health work is focused in smaller cities. So these two websites are fantastic. I actually came across this job on DevNet. And I applied really through the website. I didn't know anybody. I had no clue what the job would be like. It just said, we are looking for one person who has health or public health background, and like 10 years experience would be great, which I didn't have at that time. But I think my confidence, basically just walking into any situation with a confidence, and I was like, yeah, I'll apply. Let's see what's the worst that can happen. I will always, like, this is one thing I'll say: whenever you have to take a decision, think about what is the worst thing that can happen. If it is not life threatening, go for it, because you never know what will come out. I think a lot of things don't happen because we think, even before we start, we're like, we're not really going to get this job. The competition will be so tough. So why should I waste my time? And the truth is, you really don't know. At least you'll go for the interview. They might consider you for something else. If you're not senior enough for that job, they might think, okay, but we have another opening. So this job involved giving a written exam, then a group discussion, and then an individual presentation. So I was really at the end, like, I don't think I'm going to get this job. And the last bit was you had to make a presentation on what the UK and India can do together on health. So this was really good for me
Interesting.
because in TIS, this is just a stroke of luck. In TIS, we were supposed to do, as part of our one of our final semester questions, they asked each one of us to pick up two health systems from the world and read them up in like complete detail. And we had to present those two. And UK was one of my two. I had UK and Singapore. So when I got that question and I had like very little time, they said, okay, by next week, can you come in with a presentation on what the UK and India can do together? I was like, okay, now I'm sorted. This I know. At least I know the system. Like that helped because I knew half of the answer already. And then I just needed to match it with what India needs, which I had sort of learned at this already. So it wasn't that difficult. So, I mean, I would say that, if you are definitely, if you like clinical medicine and you're happy with it, stick with it because it's extremely rewarding. And we do need good dentists. All of us need good dentists. But if you're not happy, and you feel like you should try out something else, I would encourage you to try because you get only one life. It's not worth being stuck in a bad job. And what is the worst that can happen? That you might not get paid for a year or so, right? Or for 6 months that you are exploring this. But I think the risk is too small and the dividends are too high to not do that. So that's how I went about it, and that's how I got this job, by clearing those 4 stages. And then they sort of came back to me and said that, okay, we really like you, can you start?
Fantastic. That's great. That's great. And ma'am, then so you work at Delhi then. Then you joined at Delhi, right?
Yes, so this job is based in Delhi, but I cover almost all our geographies in India. We've got a network across all our deputy high commissions. So
Okay.
we've got people who look into health, but if we need to have like detailed discussions with state governments, particularly states where we have projects, for example, Kerala, where we have something on nurses who go into the UK, etc., to work there, then I travel and cover that. I also, pre-COVID at least, used to spend quite a lot of time in the UK. Last 2 years have been a bit difficult. Everything is now virtual. So yeah, now we're trying to do as much remotely as we can. Plus, resources have been pivoted around the world. Everyone's trying to spend less on travel, more on actually delivering projects. But the job is based in Delhi, and then I cover all our geographies in India.
So, ma'am, before we move into the next session, which is going to be about MPH specifically, I just have one little announcement to make that if at all we get cut off because the Zoom meeting is only limited for 40 minutes, I would request everybody to log in through the same Zoom ID and password. And if at all it changes, I will just put it up on all the social media platforms ASAP. So you will have no problem joining back, right? So now we're moving into the second part, ma'am, which is mostly going to be covering details about MPH, that is Masters in Public Health. So, ma'am, like in MDS, when we are doing a master's in dental surgery, we have different specializations, 9 to count, right? So, do you also have different specializations in MPH? Let's just understand that first. You have different
Yes,
subjects.
you do. Yes, you do. And actually, I think MPH has evolved a lot since I sort of got into it. And since then, it's evolved a lot. So give me just 1 second. Sorry, there's an alarm going on in my
No
house.
problem.
I'll just switch it off.
Yeah.
So different institutes offer different specializations. It's also different from MDS in the way that MDS has government recognized specialization. So, an institute cannot suddenly say start something on a, say, whatever, neural dentistry, right? They will have to take approval. However, in MPH, your specialization can be set up by the institute because government has given autonomy to institutes. What government has done is the core curricula for MPH is now recognized. So what you need to study as a basic framework in MPH is now regularized, and all good national institutes will have that same curricula, the ones that are recognized. Then you can have specializations within that. So for example, TIS offers two. One is an MPH that is focused on epidemiology, which is much more about disease epidemiology. So similar to dentistry where you have like biostatistics, Here also epidemiology is focused a lot on like the study of population, numbers,
Right.
etc. So somebody looking statistically at COVID numbers, etc. The second specialization at this is health policy, finance, and economics. So that looks a lot at how health policy is made, cost benefit, cost effectiveness analysis, decision making for any health system. Similarly, the IIPH, the Indian Institutes of Public Health, they offer three or four different streams. Like they offer MPH with a focus on health communication. They offer MPH with a focus on sort of community awareness, etc. So you've got different specializations, but these are not regulated the way an MDS is regulated. So I would suggest that when you're going for an MPH, do a little bit of research.
Right.
And I'm
What
always happy to
interests
help
you?
out as well on what interests you.
Right. So we have less than a minute left. So we were talking about different specializations and how different colleges offer different specializations. So, ma'am, how many different colleges are there? How many institutes are there which offer, or where should a student look to, do their MPH in India? When we're talking about
Right.
India
I think, sorry, yes, I think I won't have the exact number of institutes to hand, but what I would suggest is look this up because MPH is offered at least by the whole network of the Indian Institutes of Public Health. So IIPH, definitely all of the IIPH offer MPH. It's also offered by, of course, Tata Institute of Social Sciences. We know JNU offers an MPH. It's also offered by most of the good state universities now. So, wherever you see like a good state university, they will have an MPH program. So my suggestion is to do a research, do the research a little bit. Because I know even private institutes, I know DY Patil offers it. I know Symbiosis has an MPH
yeah.
program. So now there are lots of them. I think it's just about basically searching them. I would also suggest like not going to an institute that charges a whole lot because I mean, if you can get into a competitive seat in MPH, that is much better than going to like a very, very expensive institute because the starting salaries after MPH will not be like, very, very huge. Of course, if you land a WHO job is different and it's tax free. But otherwise, my suggestion would be to first try getting into a competitive seat.
Right. And ma'am, what is the normal usual fees like for an MPH?
So this depends, and this varies quite a lot because if you get into, say, a government-run institute or a like a foundation-run institute, for example, TIS is a non-for-profit, JNU doesn't really charge any profit, IGNU courses, etc. Then they'll cost very little. Like your whole course will be done in the cost of the course itself will be maximum between a lakh and a half, not more than that, and that includes obviously not stay because depends on where you stay,
The
but almost
tuition.
everything you need. Yeah, tuition, any books you need to buy, like if you need a laptop, it'll cover all of that.
Wonderful.
Private institutes have now started charging quite a lot. So I know IIPH is still sort of in the middle. So IIPH is still more reasonable, than going to like say a completely private institute. But even there, the fees will come for a 2-year course will come to something between 4.5 lakhs, which is still quite high. And then unless you can get like a scholarship, etc., they do scholarships. And then you've got some of the private institutes charge even more. Like they can even charge, something like 6-7 lakhs, and they sort of justify that by slipping in things like IIHMR in Jaipur has a tie-up with Johns Hopkins.
Yeah, yeah, I've heard
At
of this. Right.
yeah, and what they do is they basically tell students that if you join us, we'll send you for a 2 weeks summer practicum at Johns Hopkins. Now, obviously, this is great for international exposure, but honestly, if you're going to work as an MPH in India, it doesn't add a lot to what
Your
you know.
purpose, right.
Exactly. So I would not suggest that you pay 3-4 lakh rupees more just for that. I mean, if anything, if you want to do that, then it's sometimes much better to apply for like an internship or a position in the US or in the UK directly. And
Right.
institutes do have that. So, you might get more exposure working in a field level facility rather than going as a almost like a summer practicum from your institute. So that's how the money sort of increases, because private institutes will try to give you something that, that a TIS cannot offer you or a JNU cannot offer you.
And ma'am, this fees is per year or is it for the entire course for 2 years?
No, this is the whole course. This is the whole course. The whole course costs somewhere between 1.5 lakhs to 6, 7, 8 lakhs, depending
That is
upon
the
where
range.
you do it.
Yeah.
Yes.
And this would always and most obviously be a campus course, right? You would have to stay and do it. It's not a long distance course. It's not available for long distance.
You can do some. There are some courses. They are not called master's courses though.
Yeah.
There are long distance courses. You have diploma in public health.
PGD, yeah.
Yes, you have PGD. You've got trainings in population health, statistics, medical law and ethics, and different bits of public health. But I would recommend that if you're really serious about a career in public health, then it is important to do some bit of it as a residential course, because you get to like go and see the health system, which is very difficult to do, particularly if you have a job. I think it's very difficult to do this part-time with work. It's quite a challenge.
It is. You can only upgrade yourself. If you have to learn a skill altogether and make a career out of it, you have to do the campus.
Exactly.
Course. And ma'am, there are also, so is this recognized outside? If somebody wants to go abroad and work, is our course recognized? Is an MPH in India recognized abroad?
It is, but it's slightly different in different countries. So you might need to, it depends on what you want to do. So for example, in the UK, if you're trained as an MPH here in India, UK and India have now the same curricula on MPH. India's MPH curricula was designed in consultation with UK. So if you want to go and work as a public health consultant, say with a firm or an agency or an NGO, you can absolutely do that. If you want to work as a public health expert in the NHS, where you come into contact with patients, like, where your work is more, say, advising how an NHS clinic should be run, then you will have to do a bridge course or some kind of an equivalence. That will depend on your employer, what your employer actually wants you to do. In the US and India's education systems are widely different. So in the US, again, you have MPH. If you wanted to use, say, for example, your MPH to do a PhD in the UK, in the US, sorry, or a doctoral program, it would be recognized. So it's definitely recognized as a master's program. Again, in the US, what you can do as part of a job will depend on what your employer wants you to do. So because in the US, you also have public health professionals who will say, be talking to patients daily, giving them dietary advice, etc. If you want to do that, then you will have to do some kind of a bridge course on dietary modification and nutrition advice in the US, so that you know the standards, etc. So this depends quite a lot on what your job requires you to do. But in both the UK and the US, MPH in India is recognized as a master's degree.
So from what I understand is, if you want to work abroad, let's say you want to work in the UK or US, it's much better to go there and do this course there. That would sort of shorten. No, it's okay if you do it here and then go there.
Yeah, I mean, I would say again, it depends on what you want to do. See, if you want to go to the UK to stay, like longer term, then my suggestion is you do your masters in the UK, because public health is so dependent on your knowing the health system and knowing the society and knowing the culture, that you when you do your MPH here, everything. I'll know India's health system really well. I won't really know the NHS the same way. It's taken me quite a long time to understand exactly how the system works in the UK, what its strengths are, what its weaknesses are, where it should improve, etc. So if your aim is to stay in the UK or stay in the US, then you should do your masters there. Definitely. There's no doubt in that. Visas are easier, all of that. But if you want to go for education and you want to work here, then my suggestion would be you do your masters here, and whatever further international public health training you want to do that in the country where you think the education is good. Like public health training is really good in the UK because UK has a good public health system. US's health system is not really focused on public health. It's very focused on the individual's health. So that could also be a personal choice. But for me, the UK system is much better if you want to train further in public health. But if you're going to work in India, your training should be here.
And ma'am, if you could also tell everybody what NHS is, it is National Health Services.
National Health Service. Yes.
Yeah, that
So
is the
NHS
public
is
health system of the UK. If you could expand more on that.
exactly. Exactly. So UK has a national health service, which is called the NHS. It's the public health system. So it's very similar to India's NHM, if you know it, if people know it on the line. So it's very similar to the National Health Mission. The big difference is that in the UK, government has a duty of care. So that means the constitution says in the UK that any person who falls sick, government has a responsibility to provide care. And this is similar to India's government system, but not the private system. And in the UK, majority of the people will go to a public hospital. Again, because of this, the health system is a tiered health system, very similar to what we have in our rural areas. So you've got a GP, a general practitioner, who will see you first. It is also possible that you are seen first by a nurse. So there are lots of clinics that are led by nurses. Then they will decide whether you need to see a specialist, whether you need any tests. Not important that you go to see a doctor and you get tests, which is very different from how our system works now. Also not important, not sure that you'll go to see a GP and you'll get referred to say an orthopedic surgeon or a surgeon. And because of this, there are waiting times, but it's also more ethical in a way, because the people who require the most urgent care, the highest level of care, will get it. And so the NHS is paid for by the tax that the government collects. So again, it's similar to how the health system should work on paper in India's rural areas. It's also similar to how the military's health system works in India. We have a very similar tiered system in India. But yeah, that's where the difference is. So that's what the National Health Service is.
Ma'am, coming back to finishing the course, let's say you finished your course. Now, do you have something like a placement? First of all, do you have something like a semester system that you follow in your MPH? Or is it a university exam that you have after each year, like how we do in MBS or BBS?
So most MPH courses in India are run as 4 semesters. So you basically have 4 semesters. Your first semester is focused very much on foundation courses, building your foundation into health systems, as well as into political, economic, social, cultural, everything you need to know. Second semester onwards, they start introducing concepts that are very specific to public health. So if you're studying epidemiology, they start teaching you epidemiology, statistics, taking you into the community so you can actually collect data, see how data is handled. If you're doing health policy, they will start putting you in places where policies are made. You will observe how policies are made. You'll be given questions that you need to answer as a group or working with other people. Typically, say you're running a district, you have this much fund, this much population, these are the top 10 diseases. How will you structure the health system? What should your approach be? That sort of thing. Also pandemic preparedness, etc. I know now that's becoming a part of the curricula in most of the MPH courses. Third semester focuses quite a lot on your practical, whatever you've learned, getting them into paper, writing out your field practicums, etc. Lot of field exposure in MPH, so it's not so much a classroom course. Right. First year is a little bit. Second year is a lot about the research that you've done, the data that you've collected, writing it out, having a thesis. A thesis in MPH is mandatory. You do need to do a thesis, right, and you have to defend it. And then you need to, in not all institutes have this, sorry, but in some institutes, you do need to show evidence of having submitted a paper for publication before you'll get your degree.
I think this is something that even dental colleges are doing for their MPS students now, that you need to be submitting at least a few papers before you pass out, so that you're into research and you know how the exact process works. Ma'am, coming to the next question after this, do you have placements for students who are passing out after their MPH? Right.
So most MPH courses will have a placement cell and they will place people. This question is also in the chat. So some universities, because the MPH course is very new, they might not have campus placement. I would still say, apologies, that even without a campus placement, It's not really difficult to get a job. Sorry, just let me get a glass of water.
No problem, ma'am. Take your time. Any question is welcome. You can put it in the chat box right over here, and that will just add us bonus points. If I'm missing out on something, you can add that point here in the chat box.
Apologies for that.
No
So
problem.
yeah, I mean, I don't think that even if you don't have a placement cell, getting a job will be so difficult. But I would suggest if you have a placement cell, and if the institute has been running the MPH for some time, placements will definitely be better, because alumni will come and they will know that, for example, tests, a lot of the placements are just through the alumni, because the alumni are already working in so many institutes or so many organizations, and they know that there's a certain standard of students coming out of any MPH. So my recommendation would be, I don't personally know the Lucknow University MPH course. I can check around a little bit and come back to you on that, definitely, to the person who's put that in the chat. My suggestion would be to always look at how many years they've been running it for, what is their placement track record, of previous courses. But then suppose you get into MPH and you think, oh, the track record of this institute is not good. I would still recommend that you do it if you're really keen on MPH, because, I mean, I don't see a whole lot of people who've done MPH and have not got jobs. If anything, the pandemic has only made this profession, to be more in demand. People are very keen on having public health profession.
Yes, we've suddenly seen a surge of students who want to now become, public health specialists. I've had so many doubts, which is also the reason why we are making this video. So, ma'am, automatically what happens is people assume that, and they're not at fault here, that because you've done a master's in public health dentistry, then they would think that you would also have some slight idea about MPH also. Whereas I would say there are some subjects that are common, or some aspects of certain subjects that we also study that you go through too, like biostatistics and research methodology is one of those. Then maternal and child health is another. But yeah, coming from you, I think it's going to be very helpful. Another question that I had is that once you're placed, so ma'am, what kind of job prospects are there for an MPH graduate here?
Right. So I think you're asking in terms
After
of the comparison between MPH and MDS. The
no,
first
ma'am.
question
You
was,
can just tell me what are the various kind of jobs that you're looking at? What is the job market? What kind of roles do you get to play after you've done an MPH?
perfect. So that's really helpful. So the specific examples I can give you, right from the course where I was, and I see a lot of, in fact, couple of ACDS students from TES are now working in Delhi as well. So the first sort of avenue is the government. So Indian government itself recruits quite a lot of MPH people. That's both at the center and the states. We've got people working here from TIS who are from ACDS, in Delhi, in Nirman Bhavan. The kind of roles depends on where you get placed, but it's essentially the things you learn in public health. So there's program management, like how does, say you want to eradicate TB in India, how does the government go around that? What kind of systems do you need? What would your approach be? There's also quite a lot of project management, project implementation work around state government's budgets. So, how should a certain state look at having, because obviously resources are constrained. So where should they put the money? What should the system look like? What is the justification for anything? If you've done it in epidemiology, I would say most of the universities now who are looking into further research are also looking for sort of academics. So, on the academic side also, if you want to go in for a PhD and do that, that's also possible. A lot of the international organizations in India, like I mentioned, embassies, I mentioned DevNet and NGO Box, are looking for people who have done their MPH and have an experience or understanding of the public health system. That could be anybody from Gates Foundation to Wellcome Trust to Gavi, SEPI. There are so many foundations and NGOs working on public health in India that this space, there's a lot of scope actually to get placed and do some good work. There is, I think, both the questions are on training. Training, I can come on that later. Sorry. So that's I think that's the kind of job profile.
Right, ma'am. Right. And ma'am, what is another question that I think most candidates would be interested in is what is the salary range like? You don't have to give us a specific number, just the approximate range.
I think this will depend a lot on what experience you're bringing to your MPH. So if you've got like a really good experience before your MPH, you do your MPH from a good place and you get placed. I actually think salaries have gone up quite a lot. Like at the time when I passed out of this, WHO was giving out something like, 13 lakh, 14 lakh
Per annum.
packages.
Yeah.
Now this has gone up to 20, 21, 22. Like it depends on what experience you have. I think if you come to MPH as an absolute fresher and don't have work ex, then it becomes, you still get at least say between 70, 80,000 in hand. That's how you start like every month. And then slowly as you build on your career, it can go up. Ministry of Health pays similar salaries because they pay you
Very
at a
standardized
consultant
salaries
rate.
for contractual workers, right?
Yes, exactly. Because they have exactly. So they treat you as a consultant and they have fixed grades for consultants. Depends on your work experience. And then if you have an MPH, you get that, you get into that grade. So that's how I don't think salaries are the limiting factor. I think it's about how much work ex you have. You can really negotiate. The first job might not be that well paying, but I'm sure as you move on in your career, you can,
And
get
again,
paid
as
better.
far as money is important, I feel that should not be a limiting factor. If you're interested, you must go ahead and you must go after this program and do it. Not because
Exactly.
you think at the moment they're getting more paid better or there's more money. Because what if you're not good enough? What if you can't do the job well, right? So if you're interested, then go ahead and do the course. Uh, Next, ma'am, the other question that I have for you is, yeah, coming to World Health Organization. So everybody wants to go there, everybody wants to work for them. So what is it that these big organizations are looking at? And before that, I want you to tell us that is work experience an important factor before you join an MPH program in any college? Is it required?
Yes. So
Like, yeah.
yeah, most MPH degrees will have a minimum 2 years work ex requirement. They'll waive it off if if you can show like a really fantastic reason for why you should be chosen. But most institutes, particularly TIS, etc., are very strict about at least 2 years work ex. And I feel like it's really important as well because to actually understand and apply what you're learning in MPH, you should have some learnings from where you worked. Otherwise, you go directly from the clinic into a classroom where you suddenly expected to apply everything you learned. It's very, very difficult. Its work experience is important. In terms of what big organizations are looking for. So if we talk specifically about WHO, see, WHO has very specific set programs. So at any given point, they are very keen on field workers, people who are willing to go out into the field. Like for their polio program, they get in a lot of people. For immunization, in fact, polio is their top recruiter. They recruit maximum number of people for polio. Then they've got immunization programs. They have got health system strengthening programs. So essentially, they will look for work experience. Now, this is a really vicious cycle. You need good work experience to get into MPH or a good job, and you need a good job to actually get the work experience. So it's a bit vicious, but which is why I feel like you need to start somewhere. Say your first job might not be a WHO,
Right.
but start getting the work ex. And I think if you're interested in public health, I would really recommend working with an NGO for some time, and actually doing ground level work where you can see any intervention that you give being implemented, learn from that. That makes your case for a WHO or an international job that much stronger.
Right.
Because you're not being taken in just because you have an MBBS tag, which is what happens in polio surveillance. They basically want an MBBS. It does not matter whether you have MPH or not. A lot of MPH people do it because the salary is really good. But does that add a lot to your career as an MPH? If you're getting it, great. They don't tend to pick dentists in that profile. But yeah, I mean, they do pick MPH in other profiles. And again, I would say keep an eye out. WHO advertises almost exclusively through DevNet. So keep an eye out on DevNet and start seeing. And WHO system, I would say keep applying, because on WHO, you need to make a profile. All
Right.
the
Right.
UN system, when you apply, you need to create an online CV, which you can upgrade. every time they have a new opening, they'll scan all the CVs they have already. So make your profile and save it there and keep updating. That's what I would say.
Right, and it's a lengthy process. The WHO profile does not, you can't just make it in an hour or so. It is a tedious thing to do. So I would suggest take your own time, space out 2-3 hours and then go ahead and do it diligently, because you have to reflect the best of what you've done. So ma'am, if somebody is confused, because that's the case with a lot of people now, right? So what should they do? Like, they don't have any particular inclination. Let's say there's a student who says that I'm not sure if I want to go ahead and work in the clinics, but I'm also not sure if I should be doing an MPH. So should such a student go ahead and do an MPH, or should you just wait it out, get your work experience? Because I think that is the better thing to do, isn't it?
I agree. I mean, my sense is that if you're not sure you like clinics, I think you are quite clear at the end of BDS whether you like clinics or not, I think. And I mean, it depends on really what you want to do with your life. I think you really need to question yourself on what do I want to do. Will I be happy sitting in an office? Because having an MPH will mean that at least 10 years down the line, I will not be seeing patients on a daily basis. Like, I don't see patients anymore. So now I'm sat in an office. I travel all the time, sure, but that clinical component is gone. So you need to think about, I can't keep doing I'll do some practice on the side. I'll put a chair in my house. I'll also treat whoever I want to. But at the same time, then you end up being not good at anything. Choose one thing that you think really makes you happy. If clinics make you happy, go for an MDS, I would say, definitely. Because specialization is the way to go. You do want to be like in the top of your career wherever you are. I would say community dentistry MDS, do it if you're very, very interested in dental research. Yeah. Don't do an MDS in community dentistry if you want to have like an international public health career, because it's a limiting second degree.
You get cut out of a lot of jobs, because you see, ma'am, even though you study epidemiology, and I've gone ahead and done a postgraduate diploma also, but then you get that limiting factor. You cannot be labeled as an epidemiologist despite having studied that.
Exactly.
I keep on practicing biostatistics, so I've been doing it for 7 years now. But I still needed that tag of a PGD to legalize.
Yes.
So that is when you get limited. So if you want to work in India, and if you want to, I would say if you want to stay in academics and do patients, then I would say you do an MBS in community dentistry.
Yes.
And right. And if you want to get into policy making, and if you want to see how it actually works, the Indian system of healthcare works, and if you're okay with that, working in an office environment, then go ahead and do a master's in or an MPH.
I agree. Right? I agree. Yes. Yes.
Other than that, I think let's just take these questions that we have in the chat box. The first one is, how should you prepare for an MPH entrance exam, and what to prepare for the same? So let's talk about this first, and otherwise, and then other colleges. And one thing I'd like to know is, do these colleges have they have their own separate exams? I'm assuming there's no central exam for this.
No, not yet, but there is quite a lot of discussion now to have a similar exam like NEET, but it'll take some years to come in. So for the MPH entrance, I would suggest, first of all, look at where you are applying. So if you're applying in TIS has a very stringent sort of system. You've got a written exam. After the written exam, you need to clear a sort of a group discussion. After the group discussion, they call you for a personal interview. So for the written exam, they have given very clearly what are the subjects to be studied. So there is a paper on maths, there's a paper on health, which is sort of like on the health system. They don't expect you to know everything about public health, but they do expect you to know like the basics of India's public health system. And I would suggest that, in Park and Park, the book, you basically have a chapter on how India's health system is structured. That's a fantastic place to start for the health system bit. I would also suggest go through TIS's 10 years papers. They put the 10 years papers up every year and take a look at what questions have come. They give the themes very well. You also need to polish your writing because this has multiple choice and subjective questions. So they expect you to write out. So you need to think a little bit about how will I structure my writing? Will it look balanced? It should not look like the questions are quite controversial. Like they'll ask, what do you think about reservations in medical colleges? And if you obviously write that, I'm a general category student and I feel like this is very unfair and we should not have reservations, I think, yeah, the chance that you will get good marks on that is very low. But yeah, so I think one is just be socially conscious. Any big health schemes the government has launched in the last calendar year, I would say be aware of them. They tend to come in the MCQs a lot. Really brush up on your maths because I have a feeling that the maths paper was the decider for me in tests. Like people who had really good public health knowledge but didn't know maths that well could not clear the maths paper. It was really tough, the maths one. And keep abreast of what's happening. TIS puts out a lot of information on their website. So you can just find it from the website on what they're planning to do. That's how you prepare. Similarly, other MPH courses also, you will see that the websites will have the information. One thing I will say, if you want to do, if you want to move out a sort of clinical, even in clinical medicine, you really need to become internet savvy. Like you need to make sure that any website you're able to get out all the information because now is the world where nobody will share anything with you directly. They'll just say, go to our website and check. You just need to be diligent enough to look
You need
at
to do
what
your
you actually
research,
want to find
and
out.
that's important. That
Exactly.
just shows your interest also, I feel. I had
Absolutely.
stalked you a lot on Facebook before we started with this.
Yeah, and still ask you, like in test, they will actually ask you, like, what were you doing? Why have you decided to come to test? What do you know about tests? And if you appear to be, somebody who's basically just clear the written exam and have no clue, then it's more difficult for
Shows.
you. Whereas,
Yeah.
exactly. And there's a lot of competition in that exam now. So yeah.
And it's a lot like the MBA programs we have in India. They also have this same pattern, I feel. Ma'am, the second question we have is Manipal University a good course to take for MPH?
So Manipal is a good university anyway. Again, I would say the same thing because Manipal has, their fee structure is quite expensive.
Definitely.
So I would say that if you can get into, one of the totally public or foundation run courses that are great. If you can't, yes, reputation wise, Manipal is very good. So there's no problem. The only thing I would say is if you can work, it depends. If you already got a place and you're thinking, should I wait another year? I would say go for it. But if you haven't and you're targeting, then I would say target like the others as well, where you might be able to, do it for slightly cheaper. I would definitely think of that.
All right. Another question we have, which we have over here, is from Dr. Ali, and he says he's been working in the government. He's had a government job for 9 years now, and so should he go for a post graduation in community dentistry, or should he take up an MPH? Because after working in difficult COVID times, he's willing to work in policy making in the public health system.
So, I think you've answered your question a little bit yourself, doctor, because if you want to work in policy making and public health, my suggestion would be go for MPH because an MDS in community dentistry will actually now, after you've worked in COVID and broadened your horizons, it's going to narrow you again back into community dental problems. So I don't know whether you want to go back into that. If you're very passionate about community dental problems and you want to solve those, I would say go for an MDS. I think the fact that I don't know what your government job is. So
Right.
if it's not in dentistry, then it might go against you a little bit when you're going to trying to get a job because people are going to say you worked in a government job in an office and now you're going back to dentistry. Like why the to and fro? But if your government job has been in dentistry and you want to get further in the same career, matches with your career path, definitely go for it. But if your job has been about wider public health, particularly because you mentioned COVID, and then you want to be in the wider public health space, then go for the MPH. And if you have a government job, do explore the fact whether your organization might give you 2 years leave or they might sponsor part of your degree because this
Education.
happens a lot now.
Yeah.
Exactly. They might say, you're doing a fabulous job, you getting an MPH will be very good for us. So get an MPH and we'll pay part of your salary, or we can give you a 2 month leave, a 2 year leave. It's possible. So that might work out well for you.
Yeah. So I think a lot also depends. only depends on what kind of job this person has. Are you in a government job which is in the dental side, or is it in a different thing altogether? I think the only point
Exactly.
which we missed over here was that when you're looking at the competition to get into an MPH seat in any college, in any good college, you're also looking at crowds who are or students who have done their MBBS, not just right. So you have medical students, dental students, anybody else. Do people from life sciences also come ahead, and can they do an MPH? No, they do.
Yes, yes, they can. In some places they can, but mostly you'll see MBBS, BDS, you'll see homeopaths and Ayurveda. Those are the four categories. You'll see physiotherapists as well. These five you will see the maximum. You won't see anybody else. Like for example, in TIS, you can't apply with a BSc. Like you've got to have one of these five. Otherwise, you are not eligible. So, I mean, most of the competition is these five categories. I think IIPH is more lenient because they charge more, and obviously, they will probably want that kind of a profile. But I don't know about IIHMR. I think IIHMR is also similar. You have to be from one of these five categories. So I think most of the national institutes, the competition is with MBBS, other BDS, physiotherapists, homeopaths, and Ayurveda doctors.
Thank you so much, ma'am. I still can't believe it. We've crossed about, I mean, we are close to crossing 80 minutes, and I feel like I just started 10 minutes back. I had 3 full pages of questions, and we've covered everything. And I think we've covered all the reasons why you should be doing an MPH, why should you be doing an MDS, what exactly it is that the kind of skill set or the mindset that you need to have to get into an MPH program. What all different options do you have? What are the salaries looking like? What are your job profiles looking like? And what is it that you want to do? Thank you so much, ma'am. I think you've given us a lot of clarity. And for all of those people who couldn't join, I'll be putting this up on my YouTube channel, which is going to be coming up very soon. And thank you, ma'am. You've been the first guest, and I'm so happy to have you here. See, this
Thank
is
you,
where
Ipshita. It's been fantastic.
yeah, this is where your alumni will help you. I feel like ACDS has such a big place in my heart. And I just reached out to you for that reason. And, you just so graciously agreed. Had such a wonderful session with you, ma'am. And I will come back for another round because I'm sure I'll get many more questions ahead. Anything that you want to say to, and everyone who's listening, ma'am, any parting words?
No, just that I think it's a fantastic opportunity. And I definitely think that, when we went to college, it was quite a lot like, oh, you haven't been able to become an MBBS. So now you've done BDS. Okay, become a dentist. Even if you're unhappy, continue with that. And I think like the world has really changed. And I think everybody here should make the most of the fact that obviously we've been through a horrible pandemic and it's been really horrid and unfortunate for many people, all of us. But it's also shown to people why you need a more multidimensional health workforce. You need people who can plan, you need people looking at public health. So I would say go for it, and the timing has never been better to get into MPH. So, all the best to all of your listeners, and all the best to you for your new channel. And thank you for thinking of it.
Thank you so much, ma'am. It was a pleasure having you here.